Dr. Vinod Raina. I work at Fortis Memorial Cancer Center in Gurgaon. I'm heading the Department of Cancer here. What causes cancer? Well, there are many things we know that cause cancer, and the commonest in India is tobacco, misuse of tobacco and alcohol. It accounts for nearly 40% of all cancers in India if you combine tobacco and alcohol, especially cancers of the lung, the foregut. Foregut means the esophagus, the food pipe, and the windpipe, and the gastrointestinal system. So, in India, that is the data from India, but the data from abroad is also slightly similar in the sense that smoking used to be the commonest cause of cancer. Now it has come down because the incidence of smoking in many countries has gone down. So we are seeing the after effect after 10, 12 years that the incidence of many cancers which are caused by smoking is coming down. Coming to the second question of how can we reduce the incidence of cancer can be taken directly from the introduction that I have given. Since tobacco is the main cause of cancer in India, we have to cut down on tobacco use. If you cut down on tobacco use of all sorts, whether it is gutka, cigarette, and other substances that are used, sincerely, you can see that 40% of cancers in India are related to tobacco. So even if there is a 50% reduction in the use of tobacco in cancer, you can see that it will have a tremendous impact on the incidence. Incidence means the number of new cases that we see. And therefore, the load on the health services will also be reduced, and the longevity will be reduced, and the quality of these patients will also be improved. Because we see horrendous cases of head and neck cancer which are due to tobacco coming to our clinic in advanced stages. They cannot eat, they are in terrible pain, they cannot keep their health okay. So it's a terrible thing to have a cancer of head and neck region. So that's what it is. Now coming to the other cancers that are not related or that are not known. For example, there are many other cancers for which the patients cannot be blamed. They are not used to smoking, they don't use tobacco. And the best example is breast cancer. Breast cancer incidence is also rising in India by about 2% per year for the last 30 years. And in 90% cases, the cause of breast cancer is not known, but is related to aging. The commonest cause or the commonest age at which the breast cancer occurs is past 55-60. So aging is directly proportional or directly related to the cancer of the breast. But there are about 5 to 10% breast cancer cases which occur because of some abnormal genes, and they are transmitted vertically from parents to children and so on and so forth. And one of them is the BRCA gene, which is nearly responsible for nearly 5% of all breast cancers. So there's nothing you can do about this gene, but what you can do is if you identify these people who are not yet patients, children or young age, who have history of BRCA gene in the family, if you identify them young, you can take precautions to reduce or pick up their cancer very early. So this is what it is in patients who are not responsible for their cancers. But the commonest is a change in lifestyle. For example, smoking I have already mentioned, alcohol I have already mentioned. Aging you cannot help. Most of the cancers are related to aging. Other thing is obesity and physical activity. If there is obesity, there is higher incidence or morbidity from cancer. And it is clearly shown from various studies that if you are physically active and are slim, the chances of cancer development are slightly less as compared to those patients who are overweight or obese. So it's a complex situation. Cancer development occurs mostly in adult people, mostly is related to tobacco and alcohol, sometimes in some cases environment, pollution also, and in some cases inherited, but the most common is the aging process. There's not a lot you can do. Stay healthy as long as you can. And apart from that, I don't think we can do much. Some cancers are not preventable at all. There's nothing we can do about that. So that is the message I wanted to give. Thanks very much.